Afternoon. I'm Maureen Cunningham, the Deputy Director of Water at Environmental Policy Innovation Center, or EPIC. Relevant to this webinar, I'm also a town council member in a town of 35,000 people outside of Albany, New York, where I'm also based. And there's never been a better moment in time, in my opinion, than now to get rid of lead service lines. So let's get started. A few notes before we do. We are recording this webinar. So as soon as we get the recording ready and get the consent of the panelists, we'll make it available to all registrants in our follow-up materials. For those of you new to Zoom, probably not many, we are using the Q&A function, not the chat function, for any questions that come up during the discussion. We're going to hold the questions until the end of the webinar, but feel free to send in any questions at any point and we'll try and answer them. So let's get started, and I'm going to first ask everyone to put your name and affiliation in the chat box, which will allow us to see who's here and, of course, begin to build our nationwide lead-free community. The agenda today is going to be really straightforward. After a brief introduction from EPIC, we're going to hear from our 6 panelists, followed by a few questions from me before we turn it over to the attendees for questions. Then we'll wrap it up and have you on your way right on the dot at 1:30. And I'm never late. Of course, that's a joke, but we're going to try and wrap up by 1:30. Before I get too far into things, I'd like to introduce my team today. Our Executive Director, Tim Mail, is with us as one of the panelists and will help us wrap everything up at the end of the webinar with some comments. So this gives everyone a great reason to stay to the very end to hear from Tim. Our water policy intern, Olya Igorov, is on here managing the chat and other logistics, and a big shout out to her for helping me get this whole thing started. We have Lena Kurd from the Sand County Foundation, who's also helping to run the show. And right now I'm going to turn it over to my colleague, Dr. Shri Veda Shalom, the Director of Water here at EPIC, who will say a few words about who we are and what we do.
Thanks, Maureen. Hello, everyone. Thank you for joining this webinar. Some of you know us from our work here, but I see the names, a lot of new faces. So maybe I'll just give a brief introduction about EPIC. We are a Washington, D.C. based nonprofit organization. Our focus and our mission is to innovate policies, so build policies that bring faster improvements in conservation and environmental progress. Specifically in our water work, we focus on innovative policies that do a couple of things. One, improve health, access, and affordability. We seek to eliminate disparities across water systems. And eventually, we are hoping to build public trust in our water supplies. And we do that through a variety of different projects and efforts. Consolidation of water systems, especially smaller systems, partnerships and regionalization that help them leverage the strengths that larger utilities have, figuring out innovative ways to finance and fund our water infrastructure, building public trust directly from utilities through how they communicate to how the water quality reports are laid out, and obviously improving our water systems so that we can eliminate threats, especially lead in drinking water. I'll turn it over to Maureen, who has a new program that we are launching. She'll describe that and introduce the panel that will be speaking today.
Thanks so much, Trey. So President Biden said 2 weeks ago that he wants to see the country remove 100% of our estimated 10 million lead service lines around the country. And given the American Rescue Plan and the pending jobs plan, it could get a lot easier for municipalities. Unlike other water quality issues, the solution to lead in drinking water is relatively straightforward. We remove and replace lead service lines. Of course, what's not as straightforward is the fact that the lead service line from the water main to the curb is often owned by the water utility, and the service line from the curb to the home or building is often owned by a homeowner or a landlord. This makes it more difficult to remove the full service line, which is honestly the only way we're going to reach President Biden's goal. As we began to look around the country, we saw a lot of bigger cities with lead service line replacement programs and lead service line inventories and mapping, but not as many smaller cities, towns, and villages, including my own, doing these kinds of programs. So our friends at EDF have said there's an estimated 11,000 communities around the country with lead service lines. And we think that probably very few of them actually have the resources or capacity to replace them. So that's where EPIC comes in. We want to roll up our sleeves and partner with small municipalities who we're defining as municipalities with populations of around 5 to 35,000. We're going to select 5 municipalities and provide them with up to 100 hours of technical assistance, connection to resources and partners, policy guidance, including navigating the likely changes in the federal regulations, and help jumpstarting new lead service line programs. All of the information, requests for applications, and the application itself can be found on our website. The website is up, the web page for this program is up starting today, and we encourage all municipalities to apply. We're going to accept applications through June 15th, though we will consider applications on a rolling basis. So please, any of you smaller municipalities or water systems on this webinar today, please go to our website and apply. So about today's panel, which I'm really excited about, since we wanted to help municipalities with our lead-free water challenge, we thought a good place to start would be talking to municipalities who do have successful programs. So over the last few months, we've had a lot of great conversations with some of those municipalities across the country, and we thought we'd bring some of those conversations to this webinar. The city of Platteville and the city of Chelsea couldn't be more different. A tale of 2 cities. One is a college town in southwestern Wisconsin that actually used to be a lead mining town, ironically. And the other community is a dense suburb, a working class suburb of Boston with a majority Latinx population. Howard Crowfoot and Rebecca Wright will be representing these 2 cities and will describe the lead service line programs that they've been running for the past couple of years. Alongside municipal workers, plumbers and contractors are really the essential workers in lead service line replacement. So I really wanted to hear from the Laborers International Union of North America, or LIUNA, as some of us know it, to talk about that perspective. Since we're talking about best practices, maybe Kevin Riley of LIUNA can tell us how best to engage with labor in small municipalities, as well as the trends he's seeing at the national level. With the likely changes in the pipeline with the revised lead and copper rule, we know that lead service line inventories and mapping will be extremely important, which is why we're partnering with Blue Conduit, happy to say that, not only in this webinar, but also in our lead-free water challenge. Blue Conduit, as Kathleen Finlinson will explain, is a water analytics company that uses predictive modeling to locate lead service lines, and they've already done this in over 50 cities across the country. And Kathleen will tell us more about the incredible work they're doing. Bringing the whole webinar home are the people who are arguably most important for bridging the divide between local government and the public, as I well know as an elected official, the community groups on the ground. In some cases, they may be the only ones in a community who knows who has their water cut off, whose child is sick with lead poisoning, who can't afford to pay their water bills, let alone a lead service line replacement or even a water filter. And these folks are a critical piece of the puzzle to ensuring that lead service line replacement programs are effective and equitable for all residents. Harper Bishop comes from a group called Push Buffalo from Buffalo, New York. For those of us based in New York State, we have a lot of respect for Push Buffalo, and I'm so glad to have Harper here. Brenda Santos from Little Village Environmental Justice Organization in Chicago is another group we're excited to hear from. So together, these panelists will help us understand what works and what doesn't with regard to lead service line replacement, and hopefully give us further ideas of how to build better lead service line replacement programs around the country. So without further ado, I do now present our first speaker, Howard Crowfoot from the city of Platteville, Wisconsin.
Hello, everyone. Thank you for that, Maureen. I appreciate it. As Maureen stated, Platteville is a community of about 12,000. We have a satellite campus for the University of Wisconsin system here with about 8,000 full-time students. Because of this, we have a very high rental population. Over 50% of our houses are rental properties. We are not a minority heavy population. We're majority white in this community. That's the way it is. As Maureen said, we grew up, Platteville is in a mining town, or in the mining area in this region of the country. We had lead mines and zinc mines throughout the 1800s and into the 1900s. But now is anchored by the university. Here in Platteville, we started because of our Wisconsin Department of Natural Resources. They worked with the federal government to allow them to use Safe Drinking Water Loan Program funding to do what they call a principal forgiveness loan. It's a loan, but as long as you fulfill the conditions of the loan, it doesn't need to be paid back. In 2017, we didn't really have a good tracking system for who has lead lines or anything like that. Based on just anecdotal data and different things from my water department folks, I figured we had about 350. And so I applied for this loan from the DNR, figuring, well, we'll add a few. So let's get somewhere around, we got about $500,000 to take close to, you know, 450 or so lead water services away. So I'm seeing all these chats. It's really fun to see some of that stuff. So our program is basically for schools and licensed daycare facilities would get 100% reimbursement. Residential properties and any property that has residential component to it, including things like our downtown business. You know, if you've got a downtown business with residential above, then you qualify. We found out that we now have over 600 known private lead service lines, and we've taken care of 445 of them. We're scheduled to get another grant this year from the DNR loan to do additional ones. The program is critical to have our plumbers involved. The way we did this here is we had a list of pre-qualifying our plumbers. And so the 5 or 6 plumbers here in town that do work for everybody, we pre-qualified them. And so people would apply for this program. They would get the list of plumbers. They would go out and get a quote from their regular plumber. And then we would approve it. They would do the work, remove the line. If we identified that the public side was also lead, the city crews would remove it. And then the folks would get a reimbursement. We had a cap on our reimbursement. It ended up being roughly about 75% of the average cost of removing the lines. So we're still very proud of doing this, and we want to continue it. So that's good. Thank you we'll go from here. Thanks.
Thanks so much, Howard. And I turn it over to Rebecca right now from the city of Chelsea, Massachusetts.
Thank you, Maureen, and good afternoon, everyone. Just a little bit about Chelsea. For those of you who don't know, Chelsea is a small and land size city coming in at 1.8 square miles with a population of around 40,000 residents. So a lot of people in a small area. It is a 73% of the population identify as racially or ethnic minority, with about 62% of that Hispanic or Latino. So, which brings me to my next slide. Chelsea is predominantly a working class with about 24% of the residents live below the poverty line. So this is kind of a big deal to Chelsea to kind of take on this burden of cost from the residents. As Maureen mentioned, the homeowners in Chelsea are responsible for their water service from the curb stop to the water meter. However, a lot of these residents cannot afford, as you can see, a $5,100 water service replacement. So the city decided to take on this cost, and that was made possible through our drinking water service provider, the Massachusetts Water Resources Authority, MWRA. They have a lead loan replacement project that they have for Massachusetts, and that is a interest-free loan over a 10-year period, and you can apply for any amount. Chelsea has been applying for $300,000 for the past 2 years, and will apply again for another $300,000 this year. The program includes costs for engineering and construction services. So we hired an engineer to put a contract together and put it out to bid. The contract was an item-based contract, which included replacement, plumbing, resident outreach, and restoration. Following it going out to bid, it was then awarded to the lowest bid contractor. So from there, we had about 166 on that contract, but we have had other avenues that have ongoing water lead services reported, which brings me to my next slide. So the engineer that put the contract together has actually been with the city for the past 28 years. So they've been here through a bunch of capital improvement projects and have record drawings that indicate lead. I have an example of kind of the process that they went through, going through all their field notes to find lead, and these then made it to the contract. And so 166 was on the original contract. However, we also have another project with replacing water meters, and that is our own Chelsea hired technicians that go in and replace the water meters and identify if the service coming into the basement is lead or copper, and they contact me to let me know if it's lead, and I'll add it to the list. We found about 32 services from that activity, and that started in around 2019. And due to the pandemic, that process kind of slowed because we weren't able to get into residential properties this past year. So hopefully we'll be finding more over the next couple of years. Another avenue for finding services was from our residential outreach through flyers and social media, asking for residents to call in and let us know if they have lead services. And lastly, we had a local nonprofit organization, Clean Water Act, who went door knocking at 3 streets and tried to talk to homeowners and get into their basements. They were able to get into about 50% of the homes on those 3 streets, and were able to identify 7 services through that activity. Next slide, please. So I just want to wrap it up with some helpful information that I've learned throughout this project. Scheduling replacements street by street with the largest number of replacements, making that a priority, I think was the most beneficial for our contractor to mobilize to a street, and having their presence on a street for a couple days kind of alerted residents to a project going on. And they were also able to talk to residents and say, hey, can I get into your basement, and maybe verify copper or lead through that avenue as well. Chelsea, we have homeowners that are out of state. We have a lot of renters, so we don't have the best contact information. So sometimes you call and it's a wrong number. So the door hangers was very beneficial that I started this year in getting some feedback from residents and making appointments easier for the contractor and keep moving and keep the project going. And lastly, our field technicians, they were very helpful because residents would call in and say that they have lead, not really knowing for sure if they have lead. So I would have my field technician go in and verify, which is helpful because then the contractor is not making an appointment for an actual copper service, and it's a time-saving piece of information, I feel. So that kind of wraps up what Chelsea's been doing. We will continue to do this process and put it back out to bid actually this year. And we're going to keep applying for the loan and until all services are replaced. Thank you.
Thank you, Rebecca. That was great. I'm going to turn it next to Kevin Riley of Liuna to talk about the labor perspective.
Thanks, Maureen. Appreciate everyone getting on. I represent the Labor's International Union of North America, LIUNA. As Maureen said, we have over 500,000 members across the United States and Canada, and the vast majority of them are construction laborers. And so this is very important for us as a public health issue because we live and work in your communities, but it's also fundamentally a jobs issue because this is the kind of work that our members rely upon to put food on the table. And just for those who may not be familiar with the construction industry, construction laborers are one of the basic crafts. The industry is divided up according to different trades. Plumbers and pipe fitters are more likely to be inside buildings doing pipe work, but anything in the streets is going to involve a lot of laborers, trenching work, all utility scale work, and that kind of thing, as well as traffic control and a lot of items our members do. So this is really a fundamental jobs issue for us as well. And our role as a union is to advocate for the resources necessary to deliver these projects and to make sure that there are standards on that work that guarantee that these jobs are safe, that they pay a middle-class living, and that they're going to be available to workers of all backgrounds. And so that's what we've been fighting for in cities as well as at the federal level. And on that note, Maureen mentioned the American Jobs Plan. We've been very happy to see what President Biden has put forth as relates to water infrastructure generally and specifically replacing 100% of the nation's lead pipes. He's advocating for investing $45 billion through EPA's Drinking Water State Revolving Fund, and as well as wind grants. And so I think these are going to be huge assets if Congress can pass that level. And these are programs that currently have prevailing wage standards on them. So we know they're going to deliver good jobs in many areas. We also, I think it's worth noting, have a real good friend at the EPA with the new nominee for Assistant Administrator, Radhika Fox, who's very attuned to these issues and is going to be a strong advocate. So happy about that. At the local level in small cities, I want you to think of the building trade unions as really potential advocate and allies on these issues. We are politically active and active in the community in a number of places, but of course, getting money into these programs is fundamental, and making the case for that can be done not only at the city level, but with utilities. We've had experience in advocating for these funding and jobs with both public and private utilities, as well as city programs. And that really is fundamentally what's going to deliver this. One of the ways that we've added value is to also encourage labor standards and local hiring provisions on these programs. It really doubles the local benefit of these kind of job investments. And it's been helpful for us in some areas to also increase diversity within the workforce. It depends obviously on your municipality and that sort of thing. But I think that delivering local jobs with good standards is an economic development tool as much as anything. And so we are ready and willing to act as partners on helping to move these kind of programs and look forward to talking about that. Thank you.
Thanks so much, Kevin. Next up is Kathleen Finlinson from Blue Conduit.
Hi, happy to be here with everyone. I'm Kathleen Finlinson, and I'm a data scientist at Blue Conduit. We are an analytics company that helps cities remove their lead pipes. And we are going to be partnering with Epic on the lead-free water challenge program. So very excited about that. Blue Conduit has been working with communities since 2016, and we have now inventoried over 500,000 service lines, serving over 1 million people. So what does Blue Conduit do? Many cities don't know how many lead lines they have or where the lead lines are, as our other speakers from cities have already talked about. Blue Conduit helps cities organize and verify their service line records. And then we build predictive models that identify the material of the unknown lines. So we've helped our clients dig where the lead is, which reduces the time and expense to remove lead lines. We've achieved hit rates in our digs of up to 80% across many towns. So as Maureen said, there are 11,000 municipalities in the US with lead service lines, and most of them are small. Small municipalities don't have a GIS specialist or a team of data scientists. So how can these communities find their lead pipes? I would recommend starting by getting a handle on your service line inventory. At Blue Conduit, we're a big fan of random samples to avoid potential biases in historical records or in data collection. So what I would do is start with the list of all the active service lines, figure out from those which ones are 100% definitely not lead, keeping in mind that historical records are often inaccurate. So I would consider a service line verified not lead if it was recently installed or recently physically inspected. Then I would consider the rest of the lines unknown and select from those a random sample for physical inspection. The new inspections will give you a clearer picture. It'll give you a good estimate of how many lead lines you have, which is important for planning, as Howard mentioned, with their revised estimates. Then you can compare the new inspections with historical records or other data to find patterns that help you find where the lead lines are. And that kind of thing is what Blue Conduit specializes in. You might also wonder how many inspections you should do. Blue Conduit is actively researching this question, so please stay tuned.
Thanks so much, Kathleen. And next up is Harper Bishop, and I hope we're going to hear how to order a Push Buffalo hoodie in addition to other remarks.
Thanks so much, Maureen. It's a pleasure to be with you all this afternoon. I wanted to first give you context about Buffalo, New York. First of all, we're on the ancestral lands of the Seneca Nation, or the Haudenosaunee people, and I think that's important to remember. We're larger than the municipalities that you've just heard from. We're the second largest city in New York State, behind New York City, at a population of 260,000. And that population growth has really come in the last 10 years after a longstanding decline because of immigrant and refugee populations. And so that's very important and part of our fabric and our story at this time. Some unfortunate, startling statistics that also separate us is that we're the sixth most segregated and the third poorest city in the country. And so that contextualizes the work by which PUSH does work on the ground with most directly impacted peoples. Our demographics are 47% white, 36% Black or African American, and 12% Latinx, Asian, or Indigenous. And we became a majority BIPOC city in the early 2000s, and I've also had a mayor who was elected the first Black mayor and has been in office for close to 15 years now. So something that has definitely shaped the contours of our city. I'd also like to mention that, and this is important for a housing organization, is that 90% of Buffalo's housing stock was built before 1978, making us the oldest housing stock in the country. And Buffalo doubles are definitely a characteristic of our place. Slide. So as a result of that, Push Buffalo was founded over 15 years ago now on Buffalo's west side to address community needs by centering those who have been most directly impacted by inequity and injustice And of course, there's a racialized overlay on who is most directly impacted by inequity and injustice. And so Push's work slide is at the nexus between housing justice and climate justice. And I think that that's where we enter the lead space and why we're here today presenting to all of you. 9 of the highest risk zip codes for lead poisoning are in Buffalo, and they're in the organizing district that we work in. And it makes our region the most dangerous for young children nationally. And I think that a lot of people do not understand that is, they think of Flint, Michigan and other folks that have had their moment, but not Buffalo, New York. I was sharing the other day, and I'll share today, my foster daughter who is turning 6 today. It's her birthday. In 2017, had a lead count in her blood of 42. It's down to 8 today, but anything over 5 is extremely dangerous and can have lasting ramifications. And that's where the children in our community are facing challenges. And now have tracking systems through Erie County and other municipality level where if there is lead poisoning, they track that individual through school and their home and other places. Because we're talking about water today, I just wanted to mention that Push also working with coalition partners in collaboration during the pandemic made the argument that water is a human right, much like we believe that housing is a human right. And we were able to pressure the city of Buffalo to turn back on all water in the city, even those folks who were in arrears at the time, saying that everyone needed a right, and it's a public health issue, as has been mentioned previously by my other colleagues here on the panel. And then finally, I just wanted to touch on, of course, the subject that we're here today talking about is lead service line replacement. And in conversation with my executive director, Rawa Gramazian, this morning, who sends her greetings, was also talking about the fact that we are working with coalition partners to make sure, as people have mentioned as well, that low-income neighborhoods don't have to pay the service line removal fee and replacement, which folks have talked about. That I worked at City Hall as well, and when people would call, we would, unfortunately, many times I would have to tell people that really it's their responsibility from the house to the main line, and that is really the difficulty. So here on the ground, low-income people are facing between $10,000 and $14,000 that they cannot afford, and that impacts 40,000 homes here in Buffalo at this point. That's the number that we know. And I was informed actually by Rawa this morning that we are getting ready to work with Harvard and other coalition partners to essentially sue the city of Buffalo on behalf of low-income people and our constituents, if need be, in order to make sure that equity and justice is brought to all folks, and that this is an incredibly important issue to us ongoing. As I discussed, housing and climate justice are where we do our work, and so appreciate just a few minutes I had to share with you this morning. Thank you.
Thanks so much, Harper, and happy birthday to your daughter, and our regards to Rawa, who is such an important voice in New York State on environmental justice, as are you. And next up is Brenda Santos from the Little Village Environmental Justice Organization in Chicago.
Hi, everyone. I'm happy to be here. As you know, Chicago is not a small municipality. We are a city of 2.7 billion people. And I am from El Bejo, the Little Village Environmental Justice Organization. So the mission of our organization is to organize and accomplish environmental justice in Little Village and achieve self-determination of immigrant, low-income, and working-class families. We work around a number of environmental issues, including food insecurity, open space, pushing for a just transition, which means moving from an extractive economy to an inclusive economy. And what we're here for today, advocating for a number of water justice issues in different forms. So if you're not from Chicago, I'll tell you a little bit about the demographics of Little Village. Little Village is a neighborhood area in Chicago of about 100,000 people. It is predominantly a Mexican American community, largely immigrant population. with a lot of limited English speakers. It is one of the most densely populated neighborhoods in Chicago, with a large majority of its residents being renters. So Chicago has over 400,000 lead service lines in the city. Some of the it has one of the most lead service lines than any other inventories of lead service lines than any other city in the United States. Our organization has been working at a state and local level, advocating for equitable and accessible lead service line replacement programs to address the needs of these working class families. So one of the most important things to recognize doing this advocacy is that Black and Brown communities are 2 times more likely to be served by lead service lines, and by the demographics, they are more likely to be in communities with greater rates of violation of the Safe Drinking Water Act. So not only are these community members the most vulnerable, but they carry the heaviest burden of this lead problem. So one of the biggest things that we have been working on is centering the needs of these communities and looking at how we can prioritize these neighborhoods through an environmental justice, a public health, and a racial equity lens. So solving the lead service line problem in Chicago is going to take billions of dollars. There is a pilot program that is in place in the city of Chicago that is set to replace, I believe, around 700 lead service lines this year. So we are working to see how we can prioritize those very limited funds to the communities who most need it. So because at that rate, without a dedicated funding source, it'll take us over 500 years to replace all of the lead service lines in the city. We have also been working with the city to try to figure out a way to have meaningful outreach in some of these communities to ensure that they are being engaged into the program. Some of the things that we have suggested is ensuring that the city is out in these communities and hosting community meetings to discuss eligibility and encourage participation among the residents, making sure that these materials are accessible in the languages that these residents speak. So we have a largely Spanish speaking community, a large Polish population. So making sure that those 2 languages are a priority, but also making them accessible to every other language. So we are not excluding people from participating in this program. Making sure that there is homeowner education on the basics of what even a lead service line is, or what the dangers of lead are, just because some people don't even know that they have lead in their homes, or that they have lead in their water, or that they carry a heavier burden because of the cumulative environmental impacts in their neighborhoods. We have also suggested outreaching with through community organizations. So connecting with the community-based organizations in the neighborhoods that they are trying to engage, just because that level of trust is already built. That bridge is already built, and it would help in engaging the residents a little bit more. And then also finally expanding the lead service line replacement to renters in some type of way. The program is only eligible for homeowners who reside in the home where the lead service line replacement is happening. But if we expand this out to homes that are being rented out, it would impact multiple households that are living under the same building. So kind of pushing to make that happen as well. I think that's all I have in terms of what we're doing in Chicago, but I'm happy to answer any questions or anything else in addition to what I already explained. But thank you so much.
Thank you so much, Brenda. You're doing great work, and we knew you weren't from a small municipality, and same with Buffalo, but we also realize how critical community groups are to getting rid of lead service lines across the country, not just in big cities where you guys are based, but also across the country everywhere. So thank you. And thank you to all the panelists for not only for your presentations, but also the great work you're doing. And I'm just overwhelmed with the great things you're actually accomplishing on the ground. Before I turn it over to the attendees for questions, I thought I'd launch us off with a couple questions myself. And the first question I'll direct to the 2 municipalities, so Rebecca and Howard. Now that you've been working on lead service line replacement in your municipalities for a couple of years. Do you have any advice, and what is it, to other municipalities who may not have started, to overcome any barriers and challenges to get started? And if possible, to do it faster. We just heard Brenda say at the pace they're doing it, it could take 500 years. We don't have that kind of time. These lead pipes have been in people's buildings and conveying water for 100 years in some cases. So Howard and Rebecca, what would you say to municipalities who are just getting started?
Rebecca, did you want to start, or?
You could go ahead, Howard. I'll see what you say first.
Okay. Like I say, my program was based on work with our state Department of Natural Resources and the Safe Drinking Water Loan Program. It's focused on the residential properties and getting the lead from the licensed daycares and schools and stuff like that. You know, commercial properties were not authorized for that purpose. One of the things that we did, we put up a GIS on our website of known locations, and that was populating as it grew, you know, from the 350 that we knew at the beginning to now over 600. So, you know, it's one of those things where, you know, anybody could go look at it and say, I'm looking to buy a house. There's this house that I like, but it's got a lead service line. There's another one across the street that doesn't. So that's one of the things that we've been trying to use as leverage for people. Same thing, I put it into the Q&A that, you know, some of our older people say, well, I've been living in this house for 40 years and you know, I'm going to stay here until the day I die. And why should I worry about a lead service line now? You know, and I tell them, well, wait a minute, you know, yeah, we would hope that you can live in here for a long time, but at some point you will pass away, and then your children will have to sell the home for you, you know, and if it's got lead, it's going to be a lot harder for them to do that. So let's do it now while you can get money for it to help reduce the cost. And, you know, our people have gone out, talked individually, local plumbers, and that really works.
Yeah, for Chelsea, I'd say it's really just finding the services. If I could do it again, like really COVID did mess things up for us, because I was working with the water meter replacement project and having them get in these houses and replace meters street by street, so I could have an inventory of a complete street. So now that routine kind of got messed up, and I think the most efficient thing is having a good solid base of inventory before replacements, so you can efficiently replace a whole section and know, okay, Beacon Street is completely done. Where are we going next? And it's just an easy way to keep inventory and not have to go back and be all over the place. So I think working with residents and also getting your technicians into those basements and knowing for sure if there is lead or copper, and keeping a documentation of that. And yeah, inventory is everything to me.
That's good to hear, especially for Kathleen, who's going to be talking again next in a few minutes. My next question, well, first I have a comment for Harper and Brenda. You know, I think some of the community groups I've seen are some of the few people that are looking at lead more holistically as a housing issue and not just lead in drinking water. I think we in nonprofit organizations tend to parcel it up into issues. So like EPIC, looking at it in drinking water. So I think that's a really important perspective that I just wanted to mention. But my question for you, to turn it back to the municipal level, and thinking about how we move programs into more municipalities, what do you think you'd like to see more, see local governments do more of, or better, or change in terms of interacting with the public and residents, especially residents in disadvantaged communities on lead service lines?
Yeah, I think I mentioned earlier about how we're really trying to like bridge that gap between like the city and like the residents, like through community organizations, just because, that level of trust is kind of like established a little bit more. The organizations are doing like the on the ground work. And I think the only way to like really understand the problem is by talking to the people who like are experiencing that problem. Because oftentimes like people's lived experiences are different than what is perceived by like the public or like by the city. I think like thinking of like the city of Chicago, like for such a long time, they even denied that like there was a lead problem until like very recently. I think the mayor that we have now, she's the first to acknowledge that like, we need to replace these lead service lines when it has been a problem for such a long time. Even with like testing, like there's not enough being done to support like these community members and like their struggles and like their immediate needs. So definitely reaching out and like kind of just talking to residents is like one of like the most important things. And if that's not like within the capacity of like the municipality, reaching out to the organizations who are already doing these things. And then I would also say like meet the community members like where they're at, like, go to like these communities and like host these meetings, talk to them about what the problem is and like the potential solutions, get their feedback and like what is it that they want to see and like how do they want things to change. But yeah, I think that that's the like trying to find ways to be meaningfully engaged is the only way that, well, it's one of the most important ways to like ally with like community organizations.
Ditto. I think Brenda's been killing it all afternoon here, and just appreciate her perspective so much. She's saying and using much of the same language that Push does. So it's great to hear from a sister organization in Chicago, and truly appreciate your perspective, Brenda. The only thing I think I would add additionally, of course, Brenda brought up language access earlier. I think that's vitally important, as I spoke, especially for our municipality here in Buffalo. I talked to you about how many new Americans there are, immigrant and refugee populations. I live 2 blocks away from a school where over 100 languages are spoken. And so in order to get everyone on the same page and to be able to participate in democratic processes, it's vitally important that we are able to communicate effectively with the people on the ground. And then of course, as Brenda spoke about the extractive to regenerative economy, moving from there, we have to draw down the power and build up the muscle of individuals. We have to change the rules, and our theory of change is of course using community organizing, participation and participatory processes to understand what it is our community needs, because we believe that those closest to the problem have the best solutions, and those who are on the ground and where they live, they know what they want, and they don't need to be convinced of it. They have the best solutions because of it. And then we in-house have a policy and strategy department that creates the policies necessary and the changes that we need to implement at a municipal level. And then I think this is always something that I tout from the last 12 years of doing this work on the ground, is that it's not enough to just have different pieces of legislation or policies on the book. It's full implementation thereof. And we know that progressive policies are usually the ones that are on the books, but never get fully implemented or funded the way that they're supposed to. And so it's vitally important that we continue to have a grassroots movement and people holding accountable and co-governance structures to make sure that our elected officials and all those that are working in City Hall, myself included in the past, that we have checks and balances and are accountable to the people that we, especially in marginalized communities who disproportionately are impacted and yet have no way to usually voice those opinions to their elected officials or to City Hall or whoever the governing body is. So that's all I would add, but what Brenda said.
Thank you both. My next question is for Kevin. You and I both mentioned that President Biden wants to remove 100% of lead service lines in our country. And you actually mentioned, you kind of touched on my question, which when you said that we should engage laborers as allies in this goal of removing all lead service lines. But on a practical level, on a municipal level, what does that look like? If you are talking to a municipality who hasn't yet started, what does it look like to engage the labor union or movement in their community?
Yeah, it can be challenging because of the way our organization operates, but the laborers, our membership is organized into independent locals. And those locals tend to be concentrated in larger metropolitan areas. Those locals, directly elect their leadership, and they, essentially autonomously. So reaching out to those it depends. In larger cities, that you're probably running into them all the time, and your elected leadership knows who they are. I know even we have a history even in Buffalo, Push Buffalo, and laborers work together on some residential efficiency work back in the day. I was part of that, and I'm sure Brenda runs into building trades in Chicago all the time. In smaller municipalities, it's a little more challenging. You have to maybe do some homework, reach out to your building trades councils. Those are sort of the umbrella of all the trades that exist in an area. And I think there's a good track record in many cities in the labor community working on this issue. I know, Maureen, you're familiar with the work we did in Newark and other areas in New Jersey, really building equity and local hiring into the political push to get this work funded very successfully. And so that's not a very clear answer. The depends is never a satisfying answer for any question. But there's always an avenue to reach to the local area and local leadership to make that connection.
Yeah, and how many locals are there across the country in your organization?
We have over 500 locals. We have locals covering pretty much every state, but obviously our membership is concentrated in probably 15 or 16 states, mainly in areas you would expect, North, Midwest, Great Lakes, Northeast, West, Pacific West, and to some extent the Southwest. The Southeast is more challenging, although we do have some growing areas in Florida and the Gulf Coast.
Thank you. And my last question before I turned it to the attendees who seem to have a lot of questions building is for Kathleen. According to our partner EDF, there's 11,000 communities across the US who have lead service lines. I know you've worked with over 50 communities, but there's so many more to go. And I'm seeing in the Q&A in the chat that a lot of communities don't even know if they have lead service lines. What suggestions or advice, if you have it, for small municipalities who you can't get to, who don't have the resources to do this kind of inventory? They don't have a blue conduit in their back pocket. Is there any advice from you on what you've seen in doing these inventories that could help municipalities?
Yeah, thanks for the question. So I would, once again, I would say focus on getting a solid inventory as much as possible. And that can be difficult for small communities to consolidate all of their records. And I would also point out that in our experience, there's often historical records that are inaccurate. And another issue can be that the existing data, you'll have records for some service lines, but not others. Often the ones with the most unknowns, it tends to be inequitable because there can be information that has been gathered through community programs or through other infrastructure being done, like a water main replacement. And that hasn't always been done equitably. So when you have those issues in your historical records, your data will not be representative of your entire service line area. And so that's why we so heavily focus on getting a random sample. So if you can identify, as I explained before, all your service lines that you're not 100% certain of the material, and randomly select among those a certain number to do inspections. Sometimes these inspections involve some digging, and that can be expensive. Often cities can apply for funds or loans in order to do that work. And the upfront work of these inspections, it's going to reduce the total cost of your replacement program. As Rebecca Wright was saying, in their town, the replacement program works better if you know in advance more information about your inventory, because you can plan to group replacements along a street, for example, and you really need to know how many lead lines you have in order to know what your budget will be.
Thank you. And Rebecca or Howard, do you want to add to that question? Any other thoughts on inventories?
Well, I believe that, I don't remember the exact date, but it was sometime in the mid 50s when lead lines were no longer allowed to be put into homes. So, unless you have people that were doing it illegally in the 50s and 60s, that might be the first place to start, is to talk to your building inspection or assessor's department to say, okay, these subdivisions were built in the 1970s. Let's not look at them right now, because if they were following the law, they shouldn't have had lead lines to begin with. Let's concentrate on the older parts of the city that were built in the 1930s and 40s and stuff like that. So you can kind of do some of that analytics in the background like that. Fortunately, my community has a hydrovac truck, and yeah, it does do, you do some excavation, but it's relatively minor. It's not like taking a backhoe out there and making a huge hole. You're making smaller holes, but still you got to make holes in certain places and just get it done.
Thanks, Howard, so much. I want to just add to that the clarification about the building rules by municipality and what dates. So it's an extremely good point that older homes are way more likely to have lead. That has been very consistent among Blue Conduit's findings. But everyone should realize that the building rules have varied by municipality over time, and the federal ban on lead lines was not until 1986. So there have often been, like fairly recent homes we've found that did have lead lines. There's also another point I want to make is that sometimes homes were built, or maybe like an old home was demolished and a new one was built, but the lead lines were not changed out. So those are just like some gotchas that you might run into in looking at home age.
Good point, thanks.
Okay, well, thank you so much. I'm going to turn it over to Shri, who's been monitoring the questions in the Q&A function, and see what we've got.
Thanks. Thanks, Maureen. Before I get to the questions, I just wanted to also add to the point that Kathleen made about the boundary for the housing stock. That also, the same thing also applied to lead paint. the cutoff date for the lead paint was one time. I just personal experience when we were buying the house. Our house was built after that deadline, and so I told my we're talking to our agent, and then he did some background research, talked to some people, and they said that there was a lot of paint stock that had lead that was sitting in the market, and so people were trying to get rid of that as fast as possible. So that was also happening in the years after the ban was implemented. So those boundary years can be sort of questionable. We have a couple of questions. Some of them are specific to certain panelists, but others are maybe more broadly. Feel free to jump into that. I'll go back to Kathleen. There's a question from Michael Housley, who's from the city of Fort Oglethorpe. I think this is in Georgia. He says, "I've not seen a lead service line in our water system. I'm not sure if that's based on full inventory or observation of historical records." There's a similar, sort of slightly different question, so I thought maybe you can take both of those. John Rainforth, he says, "We've not seen a lead service line in a basement for years, but we've identified many from the curb stop to the main lead lines." So both the questions sort of fall on identification. What is the process for doing the inventory without excavating each line? So, goes back to some of the stuff that Blue Conduit is doing.
Thank you. Yeah, so not all cities will have lead lines. If the city is very new, it will not have very many, likely. So that might be the case with the town where you've never seen any lead lines. But also, I don't know where you've looked, basically. And like I was saying before, sometimes there's been more infrastructure work done in, for example, richer neighborhoods. Maybe the other neighborhoods are where the lead is. So doing the random sample would really help a lot with that. We usually recommend hydrovacking, where you can see part of the public side and part of the private side. Then as far as the question about the basement, I'm not totally sure I know exactly what you're asking, but there can be different material in different parts of the line, even so the private side from the home to the curb stop, that can have different components. So checking in the basement is good, but checking like at the curb stop with a hydrovac is also good. And yeah, just collecting a sample can give you a really good idea about what is in the rest of the inventory. And you can compare that to your historical records to see how accurate your records are. And this can give you a statistical way to substantiate, maybe you think you don't have any lead lines, do a sample, then you can know for sure.
Yeah. Thanks, Kathleen. I don't know if anyone else had anything to add.
I agree with Kathleen. Sometimes what ends up happening, I've had it happen 2 or 3 times, not very often, but where sometimes there's a leak in an old lead line, and what has happened is the plumber will go in and they'll just cut out a section of the lead that was leaking and just repair that one little section. I've found a couple of homes in the basement where it looks like there's new concrete near the where the line goes into the floor, and yes, it looks like it's copper coming up out of the floor, but it's a patch in the floor because they just patched that little section coming up out of the floor, and they attached to lead underneath the floor. Fortunately, that's rare, and as Kathleen was saying, hopefully if you hydrovac out by the curb stop, that you'll be able to find those.
Thanks, Howard. I might actually go back to you on a different question, and maybe even Rebecca. This is something we didn't discuss in this webinar. I don't know if you mentioned it, not because you didn't want to, but I think the question from Chad Seidel about how are municipalities addressing lead exposure until, during, and then immediately after the lead service line removal. So there is, during the process when you have lead pipes and it's going to take time. there's corrosion control, and point of use filters. Where do you see all of that fitting in? What's the total landscape of going from having lead lines to no lead pipes?
Okay, I'll start again. Quite frankly, we haven't been doing a whole lot of it. I mean, under EPA rules, our water system does our corrosion control as much as we can. We advocate, flushing the lines at first use in the morning and things like that, or use of point of use lead filters. Our community does not provide those. But I know that other communities do provide them. But we basically say, especially then after, we ask people to go ahead and flush their lines as much as possible to get any residual lead out. But we haven't really done a lot of testing or filtering or anything like that.
I'll add to that. Chelsea actually does a lead copper rural sampling program. I think they sample, 20 residents, and they compare the lead and copper results. And through that program, we monitor a number of known lead services. And for that reason, we don't replace them, just so we can continue to monitor those levels. But those levels have not exceeded, I think, even 10. So they're not concerning levels, and because Chelsea is so densely populated, we have like no frontage, and it's less than 25 feet of a lead service in most cases. So the water is not traveling a long stretch of lead. So for that reason, I think that kind of helps Chelsea in the case of keeping our lead levels low. And as for after monitoring, I will have to admit, Chelsea doesn't test the water after the service has been replaced with copper.
I guess I'll add, the city of Chicago has, so they have a testing program, and they will give you a water filter if your water tests above the 15 parts per billion, which I think is ridiculous. It should be less, but yeah, they give you a filter if you test over the 15 parts per billion. And they were also doing a meter program where they would install meters into homes. So if the homes had a meter installed, they also get filters, because there was a study that showed that when meters are replaced, the lead levels in drinking water also go up. So that was another preventative measure. And I believe they are planning on providing filters after the lead service line replacement as well.
Thanks, Brenda. That's mostly the questions we have on the Q&A, the Zoom function.
Excuse me, Shri, did we cover the one about the separate contracts between the?
Oh, lovely. I missed that.
Okay.
Yeah. So maybe this is a question for Rebecca. Do you want to answer that, or maybe even Howard? Dealing with separate contracts between homeowner and water utility, especially when there's a divide in ownership.
Go ahead.
Chelsea personally has one contract that does all the replacements. And then Chelsea, we have a water sewer drain department, and we go in and turn off the water in the street if need be. But there's never been any issue between our water sewer drain department and the contractor working together to turn off water if we have to.
Okay. We went a different direction. We could have done it the way that Chelsea did it, have a city contract do the work. I went a different direction because of our small community and everything else, and our local plumbers. We decided to pre-qualify our plumbers, and as you say, they have a contract with the homeowner to replace the private side. And then we have the forms and procedures for reimbursement up to our fixed cap. And what ends up happening is that if we end up finding lead on the public side, then my water and sewer crews go out and replace that in conjunction with the plumbers. Sometimes it's a little bit of a dance when you've got 4 or 5 plumbers working and there's only 2 of my crews that are trying to dance between the 4 or 5 plumbers that are working on different places. And that's the trade-off with what Rebecca is doing. She's doing one whole street or one whole block at a time, where I've got one plumber on this street and another plumber on another street, and our guys are bouncing back and forth. But it seems to have been working for us. We're small enough that we can do that.
Thanks, Howard. I have a question for Kevin, and then others I think have equally, they might be equally able to contribute to this. But I'm sort of dreaming here. So let's assume the jobs plan passes. There's intact. There is money for that lead service line replacement, and then as quickly as possible, the money goes out from states to municipalities. There is now a program to replace all lead service lines. What happens after that? Do we have, not taking into account the capacity at the city and municipal administration level, do we have enough contractors? Do we have enough technical staff who can, manage this process, get it done, have a timeline and say, this is the process we are going to do. And, depending on the size of the community, this is by when we would be able to do this. Is that possible, or large scale restructuring of the technical workforce is needed to even make that possible?
And we're going to get it all done by Christmas. Believe me, this is something that's keeping me up nights, because the scale of the jobs plan as it's there now, even over a 4 or 5 year stretch, is immense. And it really is required. I know that many of our locals are already underway with recruiting and apprenticeship and pre-apprenticeship pathways, trying to get ahead of it. It's always a challenge in the building trades world. You can't invest money in training folks when there's no jobs. And so it's always a bit of a gamble to get too far out in front of things when Congress has not passed anything yet. So I think the infrastructure is there. The laborers have over 50 training sites in the country that train apprentices, as well as mobile operations and a number of community level training programs and relationships with a number of pre-apprenticeship organizations throughout the country as well. So it's something we're committed to doing. Can it be done? Yes, but it won't be easy any more than it will be easy for a city to handle the contracting on this. So I'm pretty positive about it. I think the contractor base is there, the workforce base is there. It is simply a matter of how fast it can get done, I believe.
Thanks, Kevin.
Sure.
If there is nothing more to add from the panelists, I want to turn it over to Tim to say some final words about our program, our work, and where we go from here.
Yeah, thanks, Sri. I might actually ask some questions before doing that, if that's okay.
Yep, go ahead.
We're great on time, so go ahead.
Great. I wonder if, and this could be a mix of Kevin and Howard and Kathleen or anyone on the panel, you've described a mix of programs, right? So working with individual plumbers versus city contract with a sort of a bigger entity. Whether you could do both of those things. So, have a program where there are pre-approved plumbers who are doing individual replacements. You have whether it's a rebate or a reimbursement program, but also have sort of a bigger effort. And it may not, like with Howard, with your example, that may not have made sense just given the number of pipes you have. But I'm thinking about communities of 20,000 or 60,000, or neighborhoods like the one Brenda described, where you've got, potentially you need a couple of solutions, working simultaneously. So could you deploy, if you had the need, multiple approaches to try to solve this problem at the same time?
I could see that, like you said, in a larger community, I think it would make sense to do some of that. You know, if I'm doing a public street reconstruction project with water line replacement, and I'm going to be doing the public side replacement anyways, it may be just as easy, depending on the scope and the scale, to go ahead and have my contractor do all the private side lines, you know, in the same manner that Rebecca is doing. But if you're not doing that, you know, the other thing that I was looking at is knowing the community that I have. A lot of times when you get that low bidder, and that low bidder is a plumber from out of town, does, you know, this homeowner or this renter feel good about having this person from out of town come into their home to work on their plumbing when they've trusted Joe's Plumbing for all these years? And so I went that direction, so that, you know, if this person wanted Joe's Plumbing and another one wanted Bill's Plumbing or Jane's Plumbing or whomever, that they could pick the people that they felt comfortable with.
Yeah, it's a good question. I might just chime in and say, in our experience, there are often multiple contracts that might have different sources of funding or different regulations or community efforts behind them. I think it does really help if you have a good inventory to be able to combine the efforts and direct them well. So for example, in one city that we've worked in, we gave them a list of prioritized places to inspect and prioritized places for replacement. And then as their crews are doing other things nearby, they can look at that list and pick things up. So it can be, you know, obviously we're all for efficiency. So whatever your crews are doing, sometimes it can be combined together.
Kathleen, just while I have you there, could I ask you a question? It's related to something that Rebecca said, which is, Rebecca, you described basically trying to do a block at a time, like trying to be efficient. And I wonder, Kathleen, if, and Rebecca also mentioned the sort of COVID issues in terms of getting in houses and being able to check whether a house has a lead pipe or not. I wonder if there are you know, recommendations that would come out of Blue Conduit's work, where you could say, look, if you're going to go block by block, and you know, let's say you know 50% of the houses for sure, and you've got 50% you don't know, we could tell you, your model, your approach could tell you, make sure you knock on this door, make sure you do everything you can to get, you know, to that homeowner, to that renter, to be able to check, versus, you know, this one, you know, you may not, if you can check, great, but if you miss it, you know, it's probably less of a priority. Like, is there a way to use that, you know, sort of side by side with the block by block approach, use the sort of inventory and predictive analysis that you guys do?
Yeah, exactly, Tim. That is a great description of the kind of recommendations we give to clients. So we can group our recommendations, our prioritizations by block or by street or by neighborhood. And then but within that, we can give like this is no lead, this is highly likely lead, this is medium probability lead, this is low probability lead, or this is no not lead. And then from that information, they can prioritize their door knocking efforts. Yeah.
Got it.
It's a great question because we have experienced people having a hard time getting the homeowners to answer the door, or often if they're in a neighborhood with a lot of renters, it's a big challenge.
So last question for everybody, and then I'll offer some wrap up unless there's more questions that have come in, Sri or Maureen. I'm thinking about the renter versus, you know, homeowner issue, and just, you know, ideas to get past that, to make sure that renters know about, you know, the risk of lead in their water, and, you know, have as much or, you know, more power than they have today to try to advocate for landlords to to do a replacement for cities or utilities, to pay for it. So I'm just curious if any of you have thoughts on how to get at that, that renter issue. It came up in a few of your comments, but I just thought I'd circle back to it.
Most of my renters are college students. So, you end up with both sides. Some college students are very, very aware, very progressive, very knowledgeable about some of this stuff, and they care about it, and they would go on our website and find those locations and steer themselves away from it. Sometimes the parents are involved, and they're the ones that are aware and steer their folks towards or away from certain houses. But we also just try to talk to our landlords. I mean, most of our landlords are decent people and everything. We do have a few that are not very good, and we got to keep on them, but most of them understand the value of making it lead free for themselves, for the renters, and quite frankly make it easier for them to rent in the future.
Anyone else? Yeah, go ahead, Rebecca.
I'll add to that. Howard kind of touched on what I thought, and the fact that a lot of renters don't know about the lead issue. I'm personally a renter, and I used to live in Connecticut with a well water, so I didn't know anything about utilities, and I kind of feel like a lot of renters don't know about lead water. So, and Chelsea primarily deals with the homeowner, especially for water bills and service replacement. So, and I've never had anybody say, no, I don't want my service replaced. And really, yeah, I would just say it's just making people aware is a lot of the issue too. So community outreach is huge, at least in Chelsea.
Yeah, and I would just add a lot of the work that Push Buffalo does is towards tenant advocacy. And so we have championed a Buffalo Tenant Bill of Rights that we're trying to pass right now. And this conversation has really instilled in me an idea of adding something like this to the Tenant Bill of Rights, because as Rebecca has just rightfully cited, a lot of it comes down to access, and the power gap is there because the access and knowledge and understanding is towards the homeowner, and tenants oftentimes do not know what is within their drinking water, what they're able to demand in terms of having tenant rights, and we're seeing that with the eviction moratoriums that are taking place, right? That there's a whole lot of renters who feel very much like they have nowhere to go, nowhere to turn. They don't know the laws. The laws are not made to favor tenants, and there is a power differential here. And so as much as we can give that power back to tenants and renters, as you said, in Buffalo, the population is over 50% renters. And so we know that that's significant. And so, yeah, this has just jogged in my mind an additional demand in the Tenant Bill of Rights, and how we can work with municipal governments to make sure that that is included in other inspections and other ways about going and working with municipalities. So yeah, no, I appreciate actually this comment very much. It's got my wheels turning this afternoon on what changes we can make and adopt to make sure that this is added to that. Thank you.
Great. Well, I'll just jump to some closing comments and want to thank all of our panelists. And I'm going to try to connect some of your remarks to sort of broader themes and why we're just, so excited that the administration and Congress and state leaders are thinking about lead pipe replacement and trying to solve this piece, of a public health challenge that we face across the country. I want to start with Brenda, and I think of America has sort of three lead pipe problems. It has sort of smaller places like Howard City, it has bigger cities, and then it has Chicago. And Chicago is really in a league of its own when it comes to the magnitude of the lead pipe problem. But what you described is working on a neighborhood by neighborhood scale. So it's about the people that live in a particular part of a city like Chicago. It's how to get people paying attention to something that's ultimately invisible, right? Lead in your water is not something you can see or get a real connection to other than with testing or looking at the pipe. So I really appreciate the way you talked about the importance of the community engagement and outreach to try to get people focused on that. Harper, you talked about I think it was one of your children that had the high level lead blood test. My son, the same thing. When he was much younger, had a blood test and through the roof lead levels, and really had me pay attention to this issue for the first time. I was struck, I think you said that for Buffalo, replacement costs of something like $10,000 to $14,000. We've heard numbers of up to $25,000 to $29,000, and then down to a few thousand. Rebecca, you brought up 5,000 in your Massachusetts city in Chelsea. So those numbers are really important to daylight, and anything we can do to get them to be lower allows more pipes to be replaced faster. Kevin, really appreciated the labor perspective, and totally agree on the jobs and the quality and the wages of those jobs. One of the things that makes the lead pipe replacement part of this federal infrastructure push so attractive, and it should be attractive to everybody, is that compared to other kind of big infrastructure projects, a lot less of the money needs to be spent on permitting and planning, and a lot more can be spent directly on jobs to fix the problem and to fix it quickly. So an environmental impact statement on a bridge takes 4 to 8 years to get done. You can start replacing lead lines tomorrow with plumbers and field crews. So just wanted to comment on that. Kathleen, I'm really impressed that you all have 500,000 sort of lead service, or not lead service lines in your inventory at this point. That's an amazing database, and there's so much that could be learned for different places that are now thinking about inventories, thinking about figuring out where their lead lines are or aren't. So that's just really key, and trying to figure out how we get more and more places into that database, and maybe others databases as well is crucial. That's why the federal requirements on inventory are so important to us, and trying to get those inventories to happen faster, as they are at a number of state levels. Howard, love the examples that you gave of the sort of the practical work of working directly with plumbers, and I think that's just a really key strategy. It often gets lost that the people performing the work are individuals, right? Can be really small businesses that do this work with personal relationships with the people who are benefiting from the public health benefit of the replacement. So your example of doing that, of having this pre-qualification approach and contracting, having it be a reimbursable program, it's fantastic to hear that example. One of the things that Epic works on is the sort of like the most, I always describe it as the most boring thing in the world, which is procurement and contracting. And how you get money out to do work is often a huge part of how effective you are in getting that work done. So really love that example. And Rebecca, I mean, just it seems like a really good use of borrowing authority, by in a program set up by the state, backed by state and federal money, of your city, putting being willing to pay that money back for all ratepayers, all taxpayers, and sort of thinking through the details of how you run an efficient program. I love your comment, and it'll be quoted forever by me, and I expect everybody else on the team, that inventory is everything to me. So we'll remember that for a while. But wanted to thank all of you, thank everybody who joined this call today and webinar, and just we're just incredibly interested in how small places, small cities, small towns can take on the challenge of figuring out where their lead service lines are, how to pay for taking those lead service lines out, how to deliver a really strong public health outcome associated with fully replacing all those lead service lines. It's a rare problem that we can actually really solve in America, and there's not an opposing side, right? There's a very small set of people who want lead lines to stay forever. It's not an oppositional or partisan kind of thing. So it would be really exciting to be able to tell the next generation that we don't have to worry about lead in our water coming from a pipe in a house anymore, and in a decade or a little bit longer. So thank you all. Maureen, back to you. If any of you have any closing comments.
My comments are closing comments, but I am just so thrilled that this panel came together, because it's an important story to tell all these different perspectives of lead service line replacement. So thank you so much to the panelists who did a fantastic job. I also just want to do a shout out to Robert Wood Johnson Foundation and Spring Point Partners, who help support this work that we do at EPIC. I'm gonna ask Shri to post in the chat. We have an evaluation for this program. For those of you still on, we would love for you to fill out the evaluation. This will help us determine what the needs are out there of future panels that we put together on lead or other issues. And last but not least, we now have an application program up on our website. The website is posted there. And we really want to work with municipalities who want to figure this out. So please contact us, whether you want to partner with us or apply to the program. So thank you all so much. And that's it. We'll be in touch with some follow-up, including the recording.